35 across the entire district, down from about 100. From the start of the year, we had about 100, and then over the course of the year, we've seen it get a little bit smaller. But with the return to in-person learning, I think we're down to about 23 at the junior senior high, and many of them are upperclassmen who are already engaged in a lot of their courses with only a quarter to go, several seniors. And I think it's 8 or 9 elementary school students. So we did have a number of staff who are remaining in the remote only program. But we did bring some remote only staff back to in-person to accommodate, obviously, more kids. We do have a number of staff that are shifting because of, where kids are and, trying to move people into the right spots so that we can make sure all the kids get what they need, but also maybe more importantly right now, make sure we have appropriate physical distancing. So the MOA really outlines that, as it did before, that essentially we as administration are able to assign people where we need them. No huge changes to many of the things that we did in terms of deciding who was in person and who was remote. Tried to give people who were immunocompromised first shot to stay remote. If someone in their household second was immunocompromised, childcare third, and general concern last. So it worked out very well when we talked to everybody about their roles. They kind of matched up. In terms of vaccination, this is a new section of the MOA that we strongly encourage, but as the attorneys tell us, we cannot mandate anybody gets a vaccination at this point. But we also want to make sure that if someone didn't, that they are aware of sort of the challenges that may face them because they are subject to the protocols that have already existed, which stay in existence for any unvaccinated person. The change to our protocols is now the CDC has said fully vaccinated people do not need to quarantine if they are close contacts of a positive person. So, we've encouraged people. We've provided a vaccination clinic, again, thanks to the Board of Health and Hannaford's. So, we've gone over that pretty thoroughly with the union, and members know what the deal is in terms of that. We did leave, and this was, I think, in my communication today, 2 administrative days for testing. Someone who is vaccinated can still show symptoms and will need to be tested. And if someone is test positive as a result of a contact at work, they won't be charged to their sick leave time. Otherwise, everything else is very similar. I don't think any other major changes were in the MOA from the previous MOAs. So that's kind of the overview of it. I'm certainly willing to try to answer any questions if the committee has anyone. And it was, again, a very positive work environment with our union. They were very much on board on getting kids back in school. And so it made it much easier, and when we were all pulling on the same side of the rope. So that's where we're at.
Does anyone have any questions about the revised MOA? Sorry. I just want to say thank you to the staff, because I think we've been fortunate, actually, in the relationship our staff and our administrators have had. That this has worked out as well as it has. So thank you to them.
Absolutely.
And to you.
And it was a very productive day for our staff, by the way, to be able to, it was kind of like, as I said we met with some kids at the junior senior high, and we said, this is our 3rd opening day of the year. we had September 10th, September 11th, and now April 5th. It's crazy. So it was really very much like the day before school starts back in August, where, we're getting rooms set up and curriculum adjusted and materials put in place to sort of change gears again. So it was a good day for people to get lots of stuff done and get ready for kids.
Okay, so if none of us have any questions, we can vote to approve the new MOA, if someone would make a motion.
I make a motion to approve the new MOA.
And a second?
I'll second.
All in favor?
Aye.
4-0. Thank you. So with that, I also adapted the reentry plan that was originally, again, developed way back in the summer, and again we're on another iteration of that, and essentially I updated it to the in-person model, making that the the primary model, because it was originally written as a hybrid model as the primary model. The school-based teams got back together. Mrs. Priestley and Mrs. Powers pulled their groups back together. And again, that has been really, really positive for us in terms of how do we structure the school day to have staff and administrators at the school level, build it based on their experiences. And again, that has made the sort of moving forward with our staff, with our union, much easier, because they've had a seat at the table. They've helped create what it looks like. Again, the biggest change is 3 feet of physical distancing. The whole idea of some of the protocols changing with the vaccinated individual piece. So those are the major changes. Otherwise, much of what we've seen will be very similar. The schedules may change. We do have some staffing changes, moving some things around, with the return of students. So, but otherwise very similar in terms of a plan. And again, you approved it way back in the summer. With a change, I would ask that again you take this on and approve it so that we can post it as the school committee approved plan.
Just one point I want to make, and I know you're gonna send out information again to families, is the protocols in regards to health or potential, close contacts, those remain the same. And that's really important for people to remember that, because that does play into, being able to have the kids back, all of them, who want to come back full time. That's an important thing we still need to remember in our private lives, as well as when the kids go to school.
Yeah, I mean, when we met with the kids today, we talked about the physical distancing. We talked about wearing the mask. We talked about hand hygiene. For parents, it's about, if your child's not feeling well, keep them home. That rule doesn't go away. We really need kids and adults to stay home if they're not feeling well. All of the same rules still apply to students. They have not been vaccinated. So if they are not feeling well, they may need to produce a negative test to return to school. Our close contact rules remain at 6 feet. There is a question about whether that's going to be reduced to 3 feet in the coming days or weeks. The commissioner is still waiting for word back from his medical advisory team, or the governor's medical advisory team. But right now, if a student is positive and they're in the building, we need to look at close contacts within 6 feet. Again, the only change to any of the protocols is if someone is vaccinated. Otherwise, everything else remains status quo. in terms of people not feeling well, requiring tests. If people test positive, what they need to do. If they're a close contact, the quarantine days. So all of that remains exactly as it was before the return to before April 5th. So,
yeah, as long as, that's made clear to everybody, because that is, that's hopefully not going to be an issue, but we do have to remember it's a possibility. So,
yeah, and I think it's important, Mrs. Tucker, to just mention that we've seen an increase in the state numbers in communities and in schools.
Right.
The DESE numbers have gone up the last couple of weeks in, sort of in the same way the state numbers have.
Right.
And so I think you're right. I think people say, oh, we're back in full in-person learning. Everything's okay. And it's not yet. We have to follow the same rules. So if people aren't following the rules, there's a possibility we would, as we've seen a number of other schools, Barnstable and Swampscott go remote. So we got to be very vigilant about, staying home if we're sick, wearing masks, physical distancing, all those things. And we'll continue to do the same thing we have, which is identify anybody who's not feeling well, isolate them, quarantine them, look for a negative test so that, they can return. But, we want to, this is for the good of all. I know it's very difficult when it's your child, but it's really important that people remember that the rules are still in place. They have to be so that we can stay in school.
So I had to turn off my video because my internet connection is unstable. But if no one has any comments or questions, we can vote to approve the revised reopening plan. We just need a motion.
I'll move to approve the revised reentry plan.
I second.
Thank you.
All in favor? Aye.
Aye.
Okay, 4-0. Thank you very much. All right. So the last piece is Mr. Minucci came to me to ask if we could see if we could have this be a late ad on this meeting, as it's now time to get ready for preschool for next year. Preschool screenings are starting, and he wanted to request that we increase the tuition rates for the preschool program. The last time we did this was 2 years ago, and he is suggesting a 3% increase. I did put in your packet late a kind of a listing, but I'll put it up here on the screen for you. And the top part is obviously this year, and then the bottom part is next year. And you can see the differences. For residents, for half day, it would go up $6 a month. For full days, it would go up, whatever that is, about $13 a month. For people who have a reduced rate, through the free and reduced lunch program, it would go up $4 for the half day and $9 for the full. If you remember, we also have non-resident in town employees as a possibility in terms of if there are openings, and you can see those rates there. Mr. Minucci, did I miss anything?
No, Rich. I did also send information on districts in the area that charge a tuition, and we are substantially lower than any of the districts in the area that do have a tuition for pre-K.
And
so I did want to point that out.
Can you just give us a quick explanation as to why?
So sure. It really is just, it's pretty simple, Maria. It's inflationary based. So cost of items. So I know you've been in the pre-K and you know that there's a lot of different items and manipulatives and toys and other things that are part of that pre-K programming. So those those do have a cost, and those costs have gone up, and it really is to help offset those costs. And as you know, we do offset a lot of the costs of the pre-K through the tuition. So it really is just an inflationary increase to keep up with increased cost.
Okay. And so basically then the increase is actually going to go back to support the kids in the
Correct.
program.
Right. It goes. So one thing, if I can put a little plug for the pre-K program, we work with early intervention quite closely, and we've developed a program that is such a premier program that I constantly get calls from people that are outside of the district to try to try to get into the district for the programming. So the staff there has done a phenomenal job. We've really built a really good program, and this is just to keep that going. Mr. Lind, when he presented the budget to y'all, talked about that 2.5% increase per year in order to just maintain a level field, and this is very much in line with that rationale and in that thinking.
Okay. Does anyone else have any questions? Okay, no other questions, then we can vote to approve the increase to the pre-K tuition. Deb, can't hear you.
Really?
Now I can.
Oh, good thing I didn't swear. I move that we accept the proposed rate increases for the pre-K program for the 21-22 school year.
And a second?
Thank you.
All in favor?
1-0. Thank you. Well, that's our agenda. I like those meetings. 20 minutes.
I'm just gonna say one more time. I think I've said it every single meeting this year, but I want to say thank you. This year has been incredible, and not in a good way. But our staff and our administrators have been incredible, and I think our families have also been incredible as well. Last spring there was a lot of support for one another, and I think that's a wonderful thing, and it shows what a great little community North Brookfield Public School is. So I hope that, going back full time, I hope that this is the beginning of the end of a great finish to the year. So anyway, but thank you to everyone again.
No.
All right.
And just for parents, bus routes should be put out hopefully tomorrow. I know the AA is working really hard to reestablish routes again and so I will email those and post them on Facebook, and they'll be on the website and all that kind of stuff. So please keep an eye out for those if your child takes the bus.
All right, great. So we just need to motion to adjourn.
I gotcha. I move that we adjourn.
Second that.
All right, all in favor? Thanks.
Was it? Have a great night.
Have a good night.
Bye.
Thank you all.
Hi, everybody.
Thanks.